Welcome back to the Lost Info podcast. As always, it's keeping you awake, Jake. Unfortunately, the other Jake is out for today. He had something come up. And then Kane is still observing in the back, as always. That's our information finder back there, Kane. So quick little update. The new studio is coming along. We should be in there maybe by next case file, hopefully. But without any further ado, we do have this case file. We have a special guest, and our guest probably couldn't be on the show at a more appropriate time due to medical tyranny, health industry uncertainties, lockdown, masks, mandates, vaccines, vaccine passports. She is an author with a new book, COVID Operations: What Happened, Why It Happened, and What's Next. She has been featured on many documentaries. She is the founder and president of the Wellness Forum Health of 26 years, leading the movement Make Americans Free Again. She has been a longtime advocate of the people's health, testifying against legislative committees, including the USDA Directory Guidance Committee, serves on the Physician Steering Committee and President's Board of Physicians in Washington, D.C., a public policy expert. She is willing to hold the organizations at the top accountable, including government, medical professionals, pharma companies, and more. She is a true seeker of knowledge, finder of info, a freedom fighter, people's protector, medical tyranny stopper, Dr. Pam Popper. Welcome, Dr. Pam.
Thank you. Thank you for having me.
Absolutely. Well, I think, like I said, in the time that we're in, it couldn't be a more appropriate time to have you on. We've had a lot of questions, obviously, for the last year, but now it's coming to the point of, I think, everybody's kind of like, well, it was, locked down for a little while and we'll get past this. And now it's become, do the statistics match up with what's being enforced and what they're trying to enforce? And it's a weird time.
Mm-hmm.
Now, and I think we can agree that, even before the pandemic, the medical industry has kind of went rampant on, even the pharmaceuticals. They just don't get held accountable. And I think the buying of politicians and things of that nature, we all know that happens, but it's at this point that we kind of see things like right in our face.
Mm-hmm.
Before we get into all that, we usually start off the same way with our guests. And so for our fans, maybe we could just go back and kind of how you got to where you are and things that led up to this.
Yeah. So I guess last March, I felt like I'd been in training for this for a long, long time, for decades. Right. And so what happened is that I left a career in business and went back to school and got into the healthcare field. And I identified a niche in the healthcare market that turned out to be pretty important for where we are right now. And it was informed medical decision making. In other words, if you take a look at the way people buy houses and cars and other things that are important, retirement accounts, they don't necessarily do what they're told. They investigate, they ask questions. I mean, I've never met anybody where you say, well, that's a really nice car. And they say, well, I don't really like it, but the salesman said I had to buy it, so I did. Or, what a lovely home. Well, the realtor said I had to live here, right? But people who are smart buyers walk into a doctor's office and a doctor says, you need an $80,000 surgery. They go, okay, how about next Thursday? All right, no due diligence whatsoever. And so I entered the field about 27 years ago when people were starting to understand that following directions in the medical field meant that you got sucked into the medical mill and offered more tests, more treatments. I mean, we treat people who aren't sick. We label them with fake diseases and treat them with drugs and procedures. So anyway, this led to creating huge libraries and videos, and we have 3,600 hours of content and a couple thousand reference articles on every topic from kidney stones to stage 4 cancer. And in the process of creating all of this, what became very apparent is what you said earlier. You made a very important point, and that is that there are no regulators anymore.
Right.
The government is a partner with the medical cartel, and that's what it is, and the drug companies. A lot of people don't realize that in 2019, the drug and device makers paid $2.6 billion to the FDA to review their products. Okay.
Yeah.
Well, this is not going to be shocking then. 96% of everything submitted to the FDA gets approved. Well, I mean, wouldn't you love to see the 4% they turned down?
Yeah, I was
You
going to
know?
say the opiate crisis, I think, should be a big red flag to everybody that it got that crazy,
It
in a
did.
short amount of time.
Yeah, it did. And you know, even then, pretty girls who used to be cheerleaders in high school told doctors there was an epidemic of untreated pain in the United States and oxy wasn't addictive. And doctors said, okay, I mean, everybody thinks that the pill mills is where this happened, and they did their part, don't misunderstand, but there were hundreds of thousands of doctors in private practice and in medical institutions who prescribed away with this stuff.
Yeah.
And Purdue had so much, Purdue Pharma had so much influence over the practice of medicine, they re-educated the Federation of State Medical Boards to change the way that opiate prescribing was regulated from state to state, right? So, and then there had been fake pandemics. I've written
Yeah.
about this before. This isn't the first rodeo. The others were practice, I think. So when this happened back in March, I knew exactly what it was. I put out a video on March 10th. I wish I had been wrong about it, but I said exactly what was going on. I said China was behind it. The end game was going to be forced vaccine. And then I've made predictions since then, all of which unfortunately have come true. And the latest prediction I made, I've been telling people since the summer that they're going to take the children away. All right. And this is going to, I don't know if you've heard about this yet, but the CDC's had this very disturbing thing on their website for a long time that says children should be sent to school with extra medications and supplies in case they're separated from their parents. Right. And so, anyway, sorry about that.
It's okay.
In any case, there's always a phone ringing in this
Yeah.
place. But,
no, you're a busy woman.
Yeah. Well, anyway, so, and then of course, you know, all the ridiculousness going on in the schools with the masks and all this kind of stuff. And of course, I think the dress rehearsal was separating family members from older people in nursing homes. They got away with that. And they now you can't be with your family member in the hospital, etc. So this just came out this week. This is from Utica High School. This is the North Fork school system here in Ohio.
Okay.
Important parent information, off-site evacuation notice. On Wednesday, October 6th, we'll be conducting an off-site evacuation drill as part of our district's emergency management plan. During this simulation, Utica High School, Utica Middle School, and Utica Elementary School students will be transported to a safe off-site location. It's not disclosed in this notification. All right.
Yeah, that's
North
weird.
Fork. Yeah, North Fork school buses and drivers will be used to provide transportation. And then they say that they'll make sure that the kids get lunch and the whole 9 yards. They must be planning for them to be off-site for the day. Now, what I would say is any parent that got this notification and allowed their child to go to school on October 6th needs to have their head examined. And anybody watching this who's listening to this and sends their kid to school tomorrow needs to have their head examined. Get your children the hell out of these schools before they take them.
That brings me a good question, because so I just had this conversation this morning, actually, right before you with somebody, and it was kind of about, the medical industry and whatever else. So basically the conversation shortened up was, well, that's my doctor and, the CDC, the WHO, whatever, kind of all inclusive on as far as advice. These people have went to school for 7 years. I can't possibly know what they know. So I have to trust what they're saying. And so I guess my question is, why do you think it's so easy for our society to just overlook, like even getting third, fourth, fifth opinions from other physicians and just accept whatever medical, advice, even from the CDC? I mean, you're literally only getting, when they show Dr. Fauci saying that our team, it never has the team behind him saying, I support this. It's always just him as the headliner saying, hey, this is what we came up with. But it's always just, basically his opinion or whoever's telling him to say this.
Right.
So I've wondered why it's so easy for Americans in general and maybe the world to just accept these policies without any kind of questioning.
Well, I think first of all, it's not just the medical profession. It's medical profession and government. We've been letting the government take over our lives more and more for a long time.
Right.
And I think you bring up an important point for people to understand. This didn't start last February. This started decades ago.
Right.
And so that's one of the reasons why it's so hard to solve, because if they had just cooked up this thing last February and started it in March, we probably could have turned it around last summer, but we're trying to turn around close to 100 years of problems. All right. So So the first thing is the government plays a big role in this. The medical profession can't control us without government help. And we have allowed our rights to be taken away. And people are starting to understand that. It's in living color right now. I mean, the Biden administration doesn't even pretend to consider the Constitution in anything that it's doing. And that's one of the reasons why I think the parties are coming together more on this issue of we are Americans who want freedom. But just a little bit of history of the medical profession can help you understand why we are where we are. So at the turn of the last century, the average postal worker made more than the average doctor. People in the United States despised these people. They didn't want to do business with them. And we had a very robust natural health market. Native Americans had treatments, and it was very outcomes oriented. In other words, that because we didn't have the type of technology we have right now, they weren't always able to say what the mechanism of action was, but they would say, listen, when we put this paste on skin cancer, it goes away. So this works, that's why we do it, right? They did have their own medical journals. There were very good alternative medicine schools, herbal schools, naturopathic schools. Well, it's a long story how it happened, but the medical profession organized itself and managed to take over the practice of medicine and crowd out everything that isn't them. And this is the only country on the planet where that happened. If you go to Germany, if you go to Taiwan or China or any place else on the planet, what we call conventional medicine, which is the high-tech stuff, which is sometimes useful. I mean, if your appendix is rupturing, you probably do need surgery, right? Yeah. Well, that stuff is offered along with acupuncture, acupressure, herbal medicine. Not here. Everything goes except for these people.
Falls into the category of taboo or whatever.
Yeah, quackery. Everything's quackery that's not them. And this was not because the American public wanted them to do this. It was because they basically just maneuvered their way there. So it's a very powerful group of people who have done some terrible, terrible things. I mean, if you look in the background of Morris Fishbein, who was the head of the AMA for a while, and they had files on like 30,000 people who they targeted to go after. So I think that's that. And I think it's also the whole, you mentioned this earlier, it's so complicated, you can't understand it. So you need to do what you're told. Yeah. One of the things that I've never believed that, by the way, my feeling, I like to teach. I was a trainer, a sales trainer before I was in healthcare. And so when I was a sales trainer, if somebody listened to what I said and didn't understand it, it was my job to help them understand it. In other words, I couldn't say to my boss at the time, well, these people are stupid. They don't understand what I'm saying. My boss would have said to me, your job is to help them understand. Yeah, so you better figure out a way to do that, right? That's what we pay you to do. All right. So my approach to this when I got into healthcare is everybody can understand this. And they can, and we have rules for evaluating healthcare articles and that sort of thing, because you've probably seen I wrote a book, you wrote a book, this article, that article, it all conflicts. So we have some rules about how we look at research that everybody can understand. And I can teach an 8th grader how to read medical studies in an afternoon. And for the last 27 years, our clients and members have been, their doctors have been flabbergasted. We'll have people with an 8th grade education who walk into an oncologist office with a degree from Harvard and say, listen, I looked at at the studies for this treatment you're recommending to me. It extends my life by 10 weeks. I'm 45 years old. I don't think I'm interested in 10 weeks. So if you have anything else, I'd like to look at it, but I'm not doing this. And people are just like jaw drop, right? The doctor doesn't even know this. So anyway, that's all going to change, I think. I think some good things are going to come out of this. And one of them is going to be patients taking back control of their health, because if you don't do it now, they'll kill you. Yeah, I'm not kidding.
I get a lot of, well, it's kind of, they flip back and forth in that conversation from, physicians or whatever else. And then they say, well, then you're saying that the science industry is all corrupt too, because they're like, you got to trust the science. I'm like, well, I think it's the same as the government controls what's put out. And so I don't know, this whole mRNA, somehow the people are convinced that without trials and normally it would take probably 2 to 3 years of the FDA approval on anything, which I don't even think that that's really necessarily good either, but at least it's 2 to 3 years, is now that it's mRNA and this science has been happening for a decade, it's just trustworthy automatically. I'm like, now you got to trust the science. So it's kind of weird to me.
Well, but there's another issue at play too. I'm a World War II buff. I find that period of time very interesting from a personal standpoint. but also just from world impact and how Hitler did what he did and all that sort of thing. But if you take a look at what happened with Hitler and many other people like him, but he was one of the worst, obviously, they're very clever at propaganda.
Right.
And they know they're like cult leaders. They know exactly how to convince people that that something that is patently false is true. And there's a couple things that I've read that are really interesting. I recommend that people read. One is read about cults. I read a book that was written by a person who got inducted into a cult. And he said in the book, the person who is the most likely to get inducted into a cult is a person who thinks that he is so smart that that would never happen to him. And so when people say, I can't believe my well-educated friends who are academics at these big centers and all of they bought into this, they're the most susceptible because they think they're so smart it wouldn't happen to them. And then there's a book called The Lucifer Effect, which was written by Phil Zimbardo. He's the guy that did the Stanford prison experiment. We just did a couple of classes on it. And it's about, the subtitle is how good people can be led to do evil things, right? And the book is excellent. It shows how easy it is to program people. And just what the Stanley Milgram's experiments were probably the most horrifying because although it was simulated, the people didn't know that. And Milgram proved that within a matter of less than 3 hours, you could convince people to deliver fatal levels of shock to a person who got wrong answers on word games. Okay.
Yeah.
By having a person in a white coat say, you agreed to do this, and I'll take responsibility for anything that happens, okay? And you should continue. And so that's what's happened is the government, the people behind this are students of Hitler. They're students of Mao. They know how to brainwash large numbers of people. And we have a lot of brainwashable people in our country. Public education is partly responsible for this.
Absolutely. I was going to say, Operation Paperclip, we took a bunch of the Nazi scientists over here, which was all in that whole era of the propaganda, which is, I think, where it really started, where we saw the effects of what propaganda can do. Before we go too farther down the other, so one thing that I really liked when I was researching you recently, I actually haven't got your book yet. I just ordered it, but that's in the background here, by the way.
Thank you. That's a beautiful display, by the way.
Yeah, I kind of put that together. That's a needle, but you can't see it. It's a needle coming up through there. But yeah, so Make America Free Again. I was looking into the amount of focus directed at results instead of, like you were saying, in some other things that I've heard, spinning your wheels and kind of just, because it's easy to get lost. And when you think you're trying, because I've seen a lot of these videos of people going to like the school boards and they're just, yelling and ranting and raving, and there's a lot of clapping at the end. But at the end of that, it doesn't change the narrative. It's just waking some people up that get to see that video, maybe like, oh, people are standing up, and then maybe look into it, but it still doesn't change the narrative. So the Make America Free Again movement that you're starting kind of really, what I've noticed is just kind of focuses in on the direct way to change this narrative, which I really think is inspiring.
Yeah, thank you. It's Make Americans Free Again. S on the end. All of us. All right. So but I tell people every day, our enemy is a very clever group of wealthy people, unlimited resources. They've had a long time to plan this. All right. And they are very strategic and focused about what they do. And the reason I think that's important to point out is that we have two things in our country, and you mentioned one of them actually, that are the bane of my existence, and one I call it pants on fire. All right. This is where everybody's running around, screaming, hollering, waving their arms, and it essentially boils down to a temper tantrum. And theater. All right. So you chase the school board members out of the building. Well, you get to be an internet star for 36 hours, but at the end of the day, they're still the school board members, and your kid's still masked tomorrow, right? So we have that going on. And then the other thing is hurry up and file. And there have been 5,000 failed lawsuits in this country because people feel like they just want to do something with no strategy to it. We have not filed as many lawsuits. We've been pretty careful about what we've done. But after 15 months at this, we have never had a case thrown out for standing or merit. So better to have fewer cases that stick and go than just throwing it up against the wall. So with that in mind, when we took this on, this was a, I think that the reason God delivered this to me to do was, first of all, my background was good for it, for what I was doing for a living. But the other thing is I had an office full of people, and I had computers and servers and programmers. We were all set up for this, lots of phones and space. And so I had to have a conversation with the people who I work with. I just couldn't make a unilateral decision and say, this is what we're going to do. So we had a lot of conversation about taking it on. We knew that it was going to involve perhaps threats on our lives, which it has. We knew it was going to involve public scrutiny. It has. We knew that there were going to be negative aspects to it. The positive thing would be we get our lives back, right? But the one thing that was loud and clear is there had been decades of failure, which is why we got to this place. Every year more mandates for vaccines for schools, more mandates for healthcare workers. It is a standard process right now for an angry psychiatrist to call Child Protective Services and say these parents won't medicate their 5-year-olds, so they come and take them away. I mean, medical tyranny has been going the wrong direction for a long time.
Right.
So here's my point. And to your point, we just decided that if we're going to take this on, it's only going to be if, and this is a big if, we were going to not do the things that didn't work before, which doesn't sound like a radical idea, but you'd be shocked at how much time I spend explaining to people why we don't want to do the things that we did before. So what doesn't work? Well, protests don't work. They're social events. 1 million people in the streets of Germany may be inspiring, but every weekend that happened, the Germans cracked down worse the next week. Right. People protesting in Australia. Well, now they're not protesting. They're locking them up in their house. You can't even come out.
I was going to say that's a perfect example of Australia right now. But
yeah, so protests don't work. That's not going to change anything. Go because you're lonely. Don't go because you think it's going to make a difference, right? So if you need to be around humans this weekend, go find a protest. Another thing is petitions and declarations. I mean, and really, we have to constantly compare this to Nazi Germany. Do you think that what was standing between 6 million Jews burning up in the ovens and not is somebody giving Hitler a petition saying people don't want the Jews to burn up in the ovens? And he would have said, oh, okay, well, with 500,000 signatures, I don't have any choice but to let them go. Right. So that doesn't work. And then people want to write letters to their elected officials who haven't done anything for them. I mean, the executive branch has converted to being emperors and empresses and kings and queens and rulers. I mean, that's what we call our governor, the Emperor DeWine. He's not an elected official anymore. The legislature, there's one legislature that has passed one bill in the entire United States that's made a difference, and that's Montana and the vaccine bill that they just passed. The rest of them are useless. Our stupid legislature actually passed a bill, believe it or not, saying that there could be no vaccine passports for COVID until the EUA was lifted. Well, that's helpful. It takes 90 days for the thing to become a law, and the EUA was lifted by the time it did. Our little emperor signed it while smiling, all right, because we were the first to do Vax a Million, first for everything here.
That's in Ohio, right?
Everything starts in Ohio. We were the model state.
I was going to say, I did hear you mention it was the model state. I was wondering if, for our fans, if you could elaborate on that a little bit so that people can understand what that means.
Yeah.
Ohio being the model state.
So we have some emails from back in early 2020 where people were planning this and saying, has anybody told Mike DeWine yet? So little Mikey, and I call him little Mikey or the Emperor DeWine. He's about 4 feet tall. And when he's standing at the podium, he kind of looks like this these days. And he keeps getting smaller. And I have a theory about this. I think it's what happens when the soul leaves the body, you shrink.
Shrink a little bit.
Yeah, that's him.
Well, I must have a big soul.
Yeah, yeah, me too. So anyway, little Mikey we were the model state, and I have a theory about it because we were the first to lock down, first to close the bars and restaurants, first to close the schools, first to cancel events, first to mask everybody, first for the vaccine mandates, first for the Vax a Million, first for everything. I think that they needed he was at the time a popular Republican governor in a conservative state, Midwest. And I think they thought he would be a good role model. You could put him on any news station and they would eat it up. So he could be on Fox, he could be on MSNBC. And he was the toast of the town. If you go back and watch online, like all those Sunday morning shows, he was the toast of the town on all of them for a very long time. And so I think that's why little Mikey was the leader. Now, we interfered with his plans. This is the first thing where we'd become the pesky people that they wish had never happened on the scene. We also knew about the second lockdown, and we knew that was coming. We knew the date it was going to happen, and we did not get a lockdown in Ohio. And I'll tell you what happened. It was very interesting. Over the summer, You watch little Mikey's press conferences and you would see him escalate one to every day worse. And so on August 31st, he actually said he was ordering all universities and colleges, public universities and colleges, to set aside space to quarantine people. And he let it slip that the feds were going to reimburse him on a per diem basis to do this. So we figured he was going to lock up like 10, 20,000 people. Never happened. We didn't get a second lockdown because that night at 8:30, Tom Renz hit send. And that's when we sued. We were the first people to sue, challenging the emergency declaration itself. And from that point on, he became very worried about if he went too far, the judge might, start to see things our way more, So
Well, I was going to
we
say
didn't get a
that's
second.
the government incentivizing things doesn't, it's not a good look.
Right. So he backed off quite a bit. We still were the first for the Vax-A-Million and all that. But what happened after that was kind of funny. So we put him on notice, and then he still would stand at the podium and make rules, right? So he made a rule that everybody had to wear a mask, but there was a whole maskless society going on around here. And then he had this thing where, and he had a curfew. We actually sent crews of people driving around between 10 p.m. and 5 a.m. And we instructed them to drive through parking lots of police stations and everything else and honk their horns, trying to get arrested. We couldn't get anybody arrested to save our lives because we thought that would look good, right? Then he said that the stores and merchants and offices were supposed to have signs on their door. I never put one on mine, requiring masks. And if you got caught 2 times, second time with unmasked people in your establishment, they close you down for 24 hours. So we sent teams of unmasked people all over the place. Walmart taking pictures of themselves, sending it to the health department and all this workers' comp who was supposed to be enforcing it. We couldn't get anybody shut down to save our lives. So it was really for show. It really turned out to be something for show.
I was going to say, even around here, there's a group that was Northern Illinois that, well, he owns one of the biggest biker bars, but anyway, he had got a lot of people in Illinois just saying, no, we're not doing this anymore. And then the narrative started to change. Nobody got in trouble. It was more of a false promise or false threat, whatever.
Yeah. Well, what they want to do, they want the citizens to be afraid. And a lot of people did comply because they're compliant people. I'm not that type of person, but they thought that by scaring people they get compliance, and they did. But what I thought, another factoid I'll tell you that I thought was interesting, is after it was all said and done, when the gathering limits and the bars had to close at 10 and all that kind of stuff, in Franklin County where I live, there are 2 million people here. There were a total of 20 citations issued during that entire period of time, which really means that they had no intention of really enforcing it and locking people up and all that. They knew that was going to be problematic. They just relied on people to be frightened and to frighten each other and keep frightening. They figured if enough sheep watched the TV and took it to heart that they could get compliance, and they did. But there was an awful lot of non-compliance, and nobody really suffered very much as a result of it.
I was going to say, fear is one of their tactics that we see over and over, played out many, many times throughout our history. So another thing that I wanted to bring up was, so I found this interesting, but in this movement, you're building a group of national legal team, legal team. So that, I think that's important to bring into the conversation as well, because I think a lot of people, it's like, okay, we want to do this, we want to follow something, but if we have nobody backing us up, I mean, where do we go? So I think that to me was stood out as very important, that building this support team that can actually go to bat for you.
Yeah, so I'll talk about the legal team, and then I'll talk about like the grassroots thing that we're doing, because they're both versions of what you're talking about, which is you've got to have some type of infrastructure, right?
Right.
And so looking at the legal team, I mentioned the problem with hurry up and file. Well, there's another issue too. The big law firms are so conflicted. They all work for the government. They can't take this on, or they represent drug companies. They can't take this on. And so we really are looking for very special principled lawyers, and a lot of them are either in private practice or in a small group who decide that they're going to go on ahead and do this, right? And so we're building the national law firm, one attorney at a time, as they jump on board and take our cases, and they all work together and they get smarter the longer they're at it. And where this is going to become important is that there are several layers of things that have to be dealt with. One is getting our freedoms back, and then making sure this doesn't happen again. And then we have to go after the people who did this. And of course, the government has to prosecute them criminally. That's not for us to do. And I think there will be some of that. But one of the things we have to do, they're all rich and we need to take their money away,
Yeah.
which I think bothers them more than prison, actually. Too many people going to prison for 2 years and coming out to their multi-billion-dollar fortune, but we need to take their money away and give it to the people they ruined. And their wrongful death lawsuits, the people who've been killed in the hospital with these without early intervention drugs and used the ventilators, and people who died deaths of despair in the nursing homes, and people who lost their businesses. I mean, the tort lawsuits are going to go on for decades while we take money away from people who unjustly did terrible things to people and give it to people who deserve it. And then, you know, fighting this all the way to the Supreme Court until we get to the place where we will make sure this never happens again. So, so we're building a heck of a team a little bit at a time, and then the infrastructure under that. My goal is to assemble 80 million people, and we're using a very simple platform, because if the platform gets too complicated, then you get disagreement, right? That's the problem with the parties right now.
Yeah.
We don't want medical tyranny.
I was gonna say that's people too. When you pick a party line and then you have no room to figure out what's best. So
yeah, we don't want to do that. So our platform's really simple. We don't want medical tyranny. We want the right to do what we want with our own bodies, and by extension, our minor children. That's it. And I want those 80 million people meeting weekly in groups of 2 to 100, face to face in the same room, rebuilding our communities. Okay, that's going to be the secret to rebuilding our country. And so when I started my first group last year, it was to raise money for lawsuits. I thought we got to get a lot of people together. But what happened in the first month, because I was watching what was happening, people were coming to our meeting. It was growing. And of course, I was there every week. Everybody's in the same situation. We've had fractured relationships with family and friends and coworkers and all this. So everybody's looking for new friends. And guess what they find at the meeting? New friends. So they bring other people. Everybody's meeting new friends, right? And then people start talking about this business and that business that isn't doing well. So we got into the small business rescue, and we're out saving businesses. And all of a sudden, people, instead of feeling demoralized, we're winning. All right. We're gathering. Every week, we have new friends, we have new churches, we have new places to go, we're saving businesses, and what seemed like sinking into the black hole every week is kind of turning around. Then we started helping get kids out of school. Then we started a healthcare initiative to help these healthcare workers get into practices of their own, which is what we're spending a lot of time on right now, since they're leaving institutions in droves. And so there's a long game to this with the 80 million people, but the short game is you start getting your community together, people together like they used to be, working together to help their children, their families, and of course we had this great underground thing going on. We knew where to go to get mask-free this and mask-free that, and no temperature check to get your hair done, and the whole 9 yards. And we had one of our crowning achievements was a fundraiser with 400 people when the gathering limits were 10. We enjoyed that very, very much, and we thought little Mikey would be proud of us for standing up to him that way, right? So anyway, that's the thing. And once we have those 80 million people, that's part of our insurance policy to this never happening again. Because let's assume, you know, remember when Fauci said there would be a pandemic during Trump's presidency? Yeah, he's a psychic guy, right? Yeah, I wish I was psychic, because I would have started this then. Well, and then when this happened, think of how we could have undone this in a month. All right, 80 million people who won't go along. Yeah, they're done. 80 million people could have gotten over the air. If 80 million people in the United States said, we're not flying until the mask mandates are gone, would have grounded every airline in this country. 80 million people cutting up their Costco cards and sending them in. There would not have been a mask Nazi at the door anymore. All right. Oh, yeah. So then we can throw our weight around. We would be the most powerful group in the United States of America. So let me ask you, do you actually believe there was a virus, though? Like, not the whole thing behind it, but the virus itself that was spreading? Okay. Because a lot of people are like, well, when you call it a hoax, or when you call it, it's not I always say, like, you know, for me, I do believe, because I had it. So, I mean, it was definitely different than any kind of flu I've had. I lost my taste and smell and whatever else. So I know it's real, but I mean, the numbers, the way that it's been, you know, the mandates, the things that have been added to it, it doesn't really add up or make any sense on the way that they went about it. Right. So there's a virus, and people who deny that there's a virus, and you got people who say that there's no such thing as a virus, and all that's a major distraction. And our enemy, when people delve into that nonsense, okay,
Yep.
our enemy opens expensive champagne. They toast each other and say, "Those stupid humans, we knew we could count on them to do ridiculous things." So I hope we can get people away from that and focus on things that work. But having said that, there is a virus. It does make people sick. And if you take a look at what happened with COVID, it's the same thing that happens every year with flu. All right. And there's a lot of confusion about who really had what because the tests were fake. But every year, you have a group of people who are extremely vulnerable. And it's generally the geriatric crowd confined to a care home who are fragile. Now, and I don't want anybody to take this the wrong way, because whenever somebody dies, it's somebody's grandmother, mother, neighbor, whatever. This is a devastating thing. But if you are 87 years old and you take 6 medications and you're confined to a bed in a home, you probably are not going to see a year from now something's going to happen, right? It could be flu, it could be something else that happens, but there's going to be something that happens. And so that's catastrophic for the friends, family, whatever, but it's also expected. And we are all going to be in that situation someday, maybe not in the care home, but someday where we're at that precarious old age stage. Then you've got people in the general public who have comorbidities, and we've all seen this before. We had a really bad flu season about 7 or 8 years ago. And some people, everybody was exposed to it. I don't know anybody who didn't know somebody who got the flu, right? So we were all exposed to it. Most people asymptomatic, then you have people who stayed home for 2 days, then you have somebody who got really sick and was gone for 2 weeks, okay? It's the same every year, all right? And we've lived with that. And,
I guess I was gonna say, I guess the whole thing with this scenario is that, and again, it seems to be a lot of fear tactic, but the numbers is where, like people that I know close to me that were like, well, how can you say that we don't have to do certain things because we have, whatever, 2 million positive tests and 640,000 people dying of COVID, which to me, I think if you look at the numbers from previous years, it's kind of the same numbers overall of people dying, but what they're saying they're dying of is all just categorized as COVID. And
right. Exactly.
And the fear, I think, again, it comes down to, well, we got to trust the science and we got to trust the CDC and the WHO and whatever that's given us this information. And I'm like, I don't know that that's accurate to just blindly trust what's going on when you're looking at other things that line up saying that something's wrong here. The numbers aren't adding up.
Exactly. Well, and the numbers don't add up more than because we started looking into the difference in countries and that sort of thing. So one of the things I want to ask little Mikey when we finally get him in a deposition, I want to show him the map that he was using of the world. Remember when they used to put the map up and it's all red? Okay. All right. So here we are in the state of Ohio. We have about 11.5 million people, roughly, something like that. And according to little Mikey, we had 16,000 and some deaths, or 18,000. It was something like that. Okay. So in Vietnam, they have 80, 90 million people, and they had 98 deaths. How do you explain that? And they're living on top of each other. A lot of it's a third world country. In Shanghai, there were 7. Okay.
Yeah.
In Nigeria, with 209 million people, they had 1,793 on a particular day. So how do you explain this? I mean, little Mikey either was lying about how many people died here, or you got to wonder, why didn't he he's using that map every day. Why didn't you pick up the phone and call the president of Vietnam and find out how they're not dropping, and say, listen, they're dropping dead in the streets over here in Ohio. What are you doing? So their own data, and I found that this is probably one of the most important points is, we have all kinds of people who want to go into the virus doesn't exist and all that kind of stuff. Why don't you use their data to show that they're lying? Because that is so much more effective than making up fantastical stories about, there is no such thing as a virus and all that kind of thing. If you stick with what they tell us proves them wrong, essentially. The data they use proves us right.
Well, from the very beginning, it was straight confusion on when they would say something and then a month later go back on that, then go forward something else. And then people were like, okay, well, we got to stay away from people. And then it was, you can go back out, but you have to have a mask. You have to have 2 masks. Now it's like, you can have a vaccine, but the people that don't have vaccines are spreading it, yet there can be a variable. Now you have to have a booster. It's like the
It's
massive
ridiculous.
confusion is where I think people like, that I care about, that I've talked to, they're like, oh, you're on this conspiracy thing. And it's like, no, I mean, I'm not professional in a lot of things, but I can see that something's wrong with the whole picture, first
Mhm.
off. And then second of all, the numbers in comparison to years before or prior flu seasons that were more extreme than others, the numbers are still the same, except for the deaths and everything else that are due to COVID now,
Right.
supposedly. And in the PCR test, it was supposedly 70% false positives. And there was even a president, I think, of, I want to say Madagascar,
Tanzania. He was testing
Tanzania.
fruit and goats and motor
Yeah.
oil.
Yeah. Yeah.
He
And they
said they're
put
all
that out. Well,
positive.
now he's dead, but which was due to heart problems. But there's also
Yeah, right.
five other presidents that disagreed with the vaccinations that are now also deceased within a year apart of each other, and not that old. So
Yeah.
we actually put that on one of the things we've done, and obviously that was censored and taken down. But we didn't really say anything other than what was fact. They're not here anymore.
Right. Right. Right.
Um,
But even if you say something that's fact, if the criminals don't like it, it's very much
well,
Nazi Germany
actually, I
now.
think that Facebook just got in trouble recently with finding some of their truths from the heads up on trying to incite violence and misinformation campaign. And so some of that is actually, I'm actually surprised it even got to that point, because I think on Monday their stocks had dropped so fast and they shut down for a brief time or something like that. So that's good to me. I'm glad that some people are getting outed for,
Mhm.
again, propaganda, exactly what we had said, which is probably the most dangerous thing in our society, because Americans, to me, and I can't really speak for the rest of the world, but we seem to be very susceptible to our government because we trust them so much for some reason. I'm not sure why, because they've never had a good track record of trust in the first place.
Right. Well, I think the key is that if you're going to take control of a society, you're going to do it very, very gradually. And I think one of the big lessons that people are learning is that it's been very easy to see something happen that you might not think is a very good idea, but it doesn't affect you. So look at the vaccine issue. It used to be about the family down the street with kids who doesn't want to vaccinate their kids. Well, I don't have any kids, and so it's their problem, not mine. It's easy to tune out because it doesn't affect my life right now. And then the healthcare workers have to get a vaccine to work in the hospital. Well, thank God I don't have a healthcare job right now. It's not my problem. So if you take a look at that, if you take a look at education, parents screaming about the poor quality of education in their schools. Well, I live in a good school district, so it's very easy for people to say that's wrong, but it doesn't pertain to me, so I'm not going to worry about it. And then it gets worse and worse until it does pertain to you, because now everybody's being mandated to get shots, right? The same thing is true with big government overreach. I mean, when it came out, Edward Snowden was absolutely right when he brought attention to the fact that the NSA was spying on all of us and gathering data, and it doesn't affect anybody right now. So you're sitting here with your cell phone and it's gathering data, and you think, well, nobody's come knocking on my door, so it's not a big threat. Well, pretty soon they are going to be knocking on your door, and this is how they're going to do
Yeah.
it. So everybody right now is wide awake. And some people, well, I shouldn't say everybody's wide awake, but I
Yeah.
think a sizable majority is wide awake and they understand.
Actually,
And
I just brought up Snowden the other day when I had a conversation with somebody, because I thought that was pretty much in our current history. That was one guy that came forward that was letting you know, like, it's not really what you think it is. But then a lot of people, right when it happened, first of all, they didn't know who he was. A lot of people seemed to think he was the guy that created WikiLeaks for some reason. But at the same time, they were, a lot of people were calling him a traitor and this and that. Like, he gave up everything to give you information.
right.
And I think that was a quick insight on where we were headed at that time. And now fast forward.
And what I would say about that, and again, I come from a different background, but people made their judgment about Snowden without looking into it.
Yeah.
They made their, and
Oh, yeah.
look what they did here. They made their judgment without looking into it.
Yeah.
And then they become so invested in what they think they know that even when you present them with facts, they go, no, no, no.
Yeah.
You know, black is white and up is down, and you know, the whole nine yards. So it's like a you know, a bad science fiction movie to a certain extent. So I read Snowden's book, and I read it with an open mind. I thought, I don't know enough about this to have an opinion, so I'm going to read his book and see his perspective. And by the end of the book, I really understood what a hero he is and
Yeah.
was trying to be,
I agree.
and how he and I guess that was maybe, it was a while ago when that happened, but it was good preparation for right now, because I knew when I took a stand that life was going to be very difficult for me as a result of doing it. And so I didn't go into it, you know, and get blindsided by it. I expected it, it happened, and I was prepared for it. And I felt that if nobody stands up, then we can't ever make anything better. And we all have got to start standing up right now. I'll say something else too about this, you know, this brainwashing and everything that goes on. You know, because we're talking about a lot of bad things going on, right? I want to make sure that we spend a tiny bit of time on good things.
Yeah, I definitely, definitely.
Yeah.
I think it's just current on when you have to like basically catch up a conversation on the people that really don't know much. They're just, again, in the confusion. So it's kind of, you know, bringing everything into focus so that we can talk about solutions and different directions.
Yeah, so here's the good news in this whole thing. There are a couple, 3 points of good news. The first thing is that in spite of all this misery, this has not gone according to plan. I am convinced that this group of people had no intention of doing this last year. And one of the reasons I'm convinced of that is I know that they're smart and resourceful. And I've looked at all of their planning documents, and I watched Event 201 and all that kind of stuff. And there's a very, very important thing missing in all of this, and that is what happens when things go wrong. Now, let me tell you the significance of that. When we get ready to do something at our company, including this, right? We sit down and we talk about, okay, we're going to start this new thing, whatever this new thing is, right? All right, how much does it cost? All right, and what are the resources? And do we have the money? And do we have the people? Does anybody have the skill to do this thing? But there's always a part of the discussion of like, how much do we spend before we say enough if it isn't going well, right? And then is there a possibility that we could alienate clients by doing this and all? So you have the what if scenario planning. They never did this. And so either they're really arrogant and they thought nothing would go wrong. And I don't think that they're that stupid. I think they didn't have time to figure it out. So here's what happens. They strike in 2020 because they feel like they have to for a variety of reasons. And the first thing that happens is not all the countries go along with it. So you got these pesky countries with different data. And what happened to the presidents of these countries, I don't know. But as long as they were on social media talking about testing motor oil in goats, that was a problem for them. Okay, we don't have everybody in lockstep. Then here in the United States, we got this pesky DeSantis who locks down for a month and says this is bad and opens up, and Kristi Noem doesn't lock down at all. And you have this uneven. So what I think they wanted to have happen is the whole country would be shut down and the president wouldn't do it.
Yeah, state to state was completely different.
Yeah, that was a problem. And then you find, you know, who would have guessed in a million years that some feisty group out of Ohio was going to start this whole thing? And they are, believe me, they do not like us. We have knowledge of that. And so this is not going well for them. And the vaccination rate, this is very interesting too. The vaccination rate is still under 40% nationally. And I know this, and I'll tell you how I figured it out. The government's been very public about how many doses they bought. Then they've been very public about how many doses they gave to other countries. Then they've been very public, because they've whined and cried about it, how many doses they've had to throw out state by state because of no uptake. And so if you go through this whole calculation, you're at under 40%. And probably the best evidence was when Kaiser did a survey of all counties, 100% in the country. And they reported, it was done to make Trump look bad, whatever you think of him, but here's what they reported. 35% of the people in counties that Biden carried were vaccinated. This is like midsummer. And 28% of counties that Trump carried. Okay, so I think our feds got a little confused and added those numbers together instead of taking the average of the two, which means you're big time under 40%. And our Columbus newspaper actually confirmed that it was under 50% in Ohio. So this is a big problem. These people have promised somebody that they're going to vaccinate 75+% of the country, and that's not going well. So that's why you see all this scrambling around, employers with more than 100 people, and then you got Montana passes this bill. So it's not going well. And when that happens, they start to do stupid things. All right.
Yeah.
And they start to scramble around. And so they're making big mistakes right now. They're waking people up because they're moving too fast. So if you look at last year, it was very gradual. We're going to 15 days to slow the curve. Remember that? 2 weeks.
Absolutely.
And then we're going to slow the spread, and then we're going to bend the curve, or whatever their term was for it, and then we're going to wear masks, and we're going to do this, and we'll pull the kids out of school for a while. Everything was very gradual until they really created a new normal and an obedience level that was unprecedented. Now this whole business of 100 or more employees and this kind of stuff, they're real, and all these healthcare workers,
which wasn't their narrative before. I think it was right before the election. They said, I don't even think it's constitutional to be able to mandate the masks at one time, or the vaccines. And then now it's completely flopped around different. And so I guess my question also on that part brings me to think about something. If you're thinking of something that they're trying, they move too fast at this point, there's really, to me, it doesn't look like on their behalf, there's any turnaround. Like they went to the point of no return.
No,
like they kind of have to go all the way out.
Well, they're moving too fast, and people are waking up. We're getting a lot of former sheep right now who are calling and saying, I know something's wrong now. This is just ridiculous, right? And they're getting the same level of disobedience, states that won't go along. I have a friend who's an HR director for a company with over 500 employees, and 75% aren't vaccinated. So they'll just have to close. I mean, or pay the fine or whatever. So that's not going so well. They don't have an exit strategy. So at this point in time, they're going to do what Hitler did. They're going to plow ahead as if they're winning when they're not, and then we'll eventually be able to take them out. And there are a number of different scenarios in which this can happen, and there are a lot of them not very pleasant. So I think we just get ourselves ready for whatever, and the people who are tied together in groups like ours at the local level will help each other get through it. We all have farmers we buy directly from here. I mean, nobody in the Thursday groups is going to starve, if they're setting themselves up right, so anyway, it's going to be really painful, and it's going to get worse before it gets better. But the getting worse, I don't like it, and I don't like to see people suffer. But I do like to see this fall apart, and it is falling apart at the federal level. I mean, if you take a look at, nobody's even watching the White House press conferences. They finally took it down. It would be embarrassing. Like 2,600 people watched it.
Well, I think they realize how many times they've said something, and then they've had to basically eat those words. And it just gets to the point, like you said, people are like, even the people that aren't really, let's quote unquote woke, but they're like, wait a second, this is flip flop so many times. Now this is just strange. So I agree. I think that is happening at a alarming rate for them, which is good for us. Yeah, it is. It's just, but now it's just having the fortitude to say, we're going to keep pressing ahead with the resistance, with the lawsuits, and I'll say something else about the lawsuits, because I think this is important too. People say, well, the courts are corrupt, and some of them are. But if you file and file and file and file, you get luckier the more you file. All right, because we only need discovery one time. We don't need to depose Fauci 11 times. One time for 4 days, we're good. We don't need the CDC to deliver documents to 36 different locations. One, and we share it with everybody, right? So when you file one lawsuit, you got to be 100% successful to get what you want, which is their documents. If you file 2 lawsuits, you only have to be 50% successful. If you file 100, you only have to be 1% successful. And I've always been a numbers person. I came from the direct sales business, right? I was going to say sales, 10% rule. Right. So the harder I work, the luckier I get, the more I file, So the bottom line is we're setting ourselves up to where we don't have to be ridiculously successful to be ridiculously successful from a probability standpoint. And this strategy has been used before, by the way. I mean, the Sackler family those are the Purdue farmer people back when we were talking about the opiate thing. They had insulated themselves by using literally blank checks to get records sealed. Right.
And at a certain point in time when it was apparent that they've been responsible for hundreds of thousands of deaths, right? That was the strategy that brought them down. Just file and file and file and file, wait till a jurisdiction where some judge says, I'm going to get you what you want. I'm going to let you see all this stuff and unseal records. And Dan Polster in Ohio is the guy who really kind of saved the day. So I think we'll have the same thing happen here. So we're just being patient, working hard.
Right.
And we expect that this will be a happy outcome. And I'll say one last thing I want to say, because I know we're running out of time, is that I'm 65 years old, and as long as I've been an adult, we've been talking about education reform. Anybody seen any education reform? I haven't.
No.
How about government reform? Gets
No.
worse every year. How about reforming the healthcare system? Gets worse every year. Sometimes you have to blow it up to rebuild it.
Yeah.
And that's what's happening. We're going to rebuild all of these things the way that we want to. And I do think that in about 10 or 15 years, we'll look back on this and say, this is just horrific what these people did. And they have to pay for what they did, both criminally and financially. But having said that, what we did with it was to make some things better. And then that will at least have made the suffering somewhat worthwhile.
So on that, just before we get too far off that, how can people start these groups themselves?
Yes, send me an email at pampopper@msn.com.
Okay.
And I hold a conference call every Thursday at noon. I show people at Eastern time. I show people how to get started, answer their questions, and some of them call in with questions like about what's going on in their life too, and I'm happy to entertain those as well. So send me an email, pampopper@msn.com. We'll show you how to set up a group. It'll be the best thing you ever did. And people say, well, I never did anything like this before. Welcome to the club. I never did anything like this before. So we're all in this, at the same point.
But that's probably the most important, is that the people, take a part and start one of these groups in their community, so that we can get to that 80 million people.
And you will look forward to it every week. Thursday, I'm fortunate. My business has always been open, never had to close anything. I've been disconnected from all the people I used to know, but my life has been pretty intact. On Thursday night, still the best part of my week. So you'll be glad you did it, right?
Yeah.
And then if you're a healthcare worker, send me an email at pampopper@msn.com. My company, I'm a school. My company has been getting healthcare workers who want to be outside the system, helping them to do it for the last 20 years. We can help you too. And if you are a parent.
And that's in order to create a new health care plan, kind of an organization that you can get more accurate resources, information, education on health, and make
go to people who aren't part of the system. Again, my age, I'm showing my age here, but when I was a kid, we had a family doctor. He took care of our family, my parents and my sister and I, and my maternal grandparents, my aunt and uncle and 5 cousins. He knew our family. He took care of our family. He was a trusted doctor. He didn't answer to anybody. He answered to himself, right? We've got to get back to that, that very independent healthcare practice where the family doctor, family nurse practitioner, the people who are taking care of you know who you are. I had somebody tell me the other day that she has never had the same cardiologist at the Kaiser facility she goes to for healthcare. She makes an appointment with the department, not a doctor. Okay, that has to end, because the department can't know about you, care about you, have an interest in you. A human being is what's required. So we're helping a lot with that. And if you're a parent who needs resources, we have the biggest homeschool resource center in the country on our website at makeamericans.freeagain.com. And we can provide private coaches and people to help you with whatever you need as well.
Absolutely. That's important. That's definitely important for the future that we want to pave.
Yes.
Before we get going, there's a lot of other questions I have, but I mean, we don't want to go over time. What we'll do is we'll keep this open, if it's okay with you, that maybe have you on at another time.
I'd love to come back.
So before we separate ways for today, maybe you could give a quick overview on your book, because I think that this book is going to be pretty successful, being that a lot of people have so many questions. This kind of already in the title, what happened, how it happened, and where we're going next, is all the questions kind of relieving. So without too much, I guess, without taking too much of your time, maybe just give them a little overview on some of maybe the statistics or what you're gathering in that book.
Yeah, well, I'm known for being a good researcher, and this is a very well-referenced book. And I wanted to tell the story from our perspective, and our perspective is a little bit different. It kind of goes back to, the virus doesn't exist. Let's come down to using actual data that's indisputable, including a lot of it that's theirs, right? And let's tell the story from that perspective, because it's much more compelling. It's sexier to do a pants on fire hypothesizing about some hidden ingredient in the vaccine that's going to kill us all on the sidewalk tomorrow and all. I mean, that's sexy. It gets you a lot of attention. But I think what really is going to make a difference in the long term is a very measured approach to looking at this. And the other thing that we're very good at my company, and I think we do well, is making things understandable for people. It's very logical. Okay, so it starts with what is actually behind this, like who started it, what happened, and documenting it all the way. And I contend and write about it in the book that in order for this to happen, you have to have an education system that turns out generations of stupid people. You have to have a media that's corrupt. You have to have a government that's overbearing and gotten more so over a period of time, and a medical system that's just beyond the pale, off the charts corrupt. And those four things are the ingredients. And then if you understand that, then you start to understand how they actually did this and what happened. And then, in terms of what happens next, the way that I talk about it at the end is it's kind of up to us.
Right.
Okay, this thing has been done to us. And we can sit here and let it happen, or we can rise up and do something about it. And one scenario, and it's kind of happening here to a certain extent, is people just start ignoring it. I've seen the beginnings of this, like when the local mayors started saying we're going to mask up again. There's a mask mandate in Central Ohio, and having said that, there's no place I go where they're enforcing it. The employees aren't even wearing the masks. It's like everybody, okay, you want me to put a sign on the door, great. You want us to say we're going to enforce it, great, but we're not. People can't afford it anymore. The restaurant owners in New York are saying their business is down 60% because people just won't come in with the
it's to me, it's just weird. We actually went to a restaurant. 3 of the people that we were with, well, we all wore masks going in, which I'm just like, yeah, whatever. So we wore a mask going in, and then you order, but you kind of have to go up to the counter or whatever else. So we get back to the table, take the masks off to drink, then go back up to get ketchup or whatever else without masks. It's like,
that's okay.
How stupid is this that we shouldn't even have came in with masks in the first place? It doesn't make any sense.
People aren't doing it anymore. They're just not doing it. And so we're seeing it, just the general disobedience and the business of pulling kids out of school. The 2020-2021 school year, homeschool went from 2 million to 5.5 million kids. All right.
Yeah.
In August, 13% of what remained was withdrawn, and the withdrawals continue as they get crazier. Well, if it doesn't do any good to make all these rules in the school if people don't send their kids to school. You can't brainwash a future generation that way. And it doesn't do any good to have all these rules in the medical centers if people just say, I'm not going to go, and the workers won't show up and work. And so my prediction in the book, and my predictions about all of this have been pretty good since the beginning, as I mentioned before, is at some point in time, people will just stop complying, and then it will start to unravel quickly, because the government doesn't have any ability to do something about even 50 million people who just won't do it anymore. And that's starting.
And yeah, it's obvious that is getting to a point, which I thought it would have been sooner, to be honest, than 2 years later at this point. But before we let you go, one other thing I'd like to ask you is, just in your professional opinion, so let's say that this was kind of like a test run or something, and that they release a more extreme virus or something of that nature. Where do you think that we should actually take our knowledge base from, or advice, when we know that this one went way too far outside of our control, crazy? And so, like, if something more happened, what do we do then? Do we just, Well,
part of the problem is, and I said this last year, is public health it has damaged its reputation so much that if there were ever a big problem, people would yawn and go on about their business.
Right.
So there are a couple of things that could happen. They unleash something really horrific, and it really does kill a lot of people, and nobody listens this time. You told us to wear a mask last time. It's kind of, so that's one possibility. The other possibility is that they may not do that, or save it for another time, because what they really want is control over people. Like releasing viruses to kill people is not as much of interest to them. It is partially because they would like to depopulate, but they're much more interested in control over people.
Right.
And they don't get any control over people by just killing people. You know what I mean?
Yeah.
It's
blatant.
In fact, by killing people, they may incite losing control.
Well, I think that they kind of got a little taste of that currently. So
yeah,
absolutely.
Well, we'll see.
Yeah, we definitely appreciate your time. Like I said, you're very inspirational on the movements that you're doing, the things that you're involved in, the way you're going about them with a focus of results instead of spinning your wheels. Do appreciate it. Again, anybody on here, you can find all of the ways to contact her in the links below and buy her book and things of that nature. Also, we will put her email if you'd like to get a hold of her and start a group, because I recommend that might be the best option for everybody listening, is that take the first step and start the group in your community so that we can eventually get on to the next phase of this, which is basically starting over.
Right. Exactly. Thanks for having me.
Absolutely. It was an honor. Thank you very much. Have a good one. Bye. Well, there you have it. Dr. Pam Popper. She is, like I said, I was researching her and I really do like everything that she has to offer. She's very focused on solutions. I mean, there's not much more to say other than probably get her book and read some more about it. I'm still waiting on my copy because I ordered it, but I wasn't here before I had this interview. But she's doing the right things. So I don't really, I was wondering about make Americans free again, thinking like that might be, she's on the side of a political party, but obviously she's not concerned about that whatsoever. So her work speaks for her, and I can say that that's more important than anything else. Obviously, there's still a lot to do and lots of things to come, but she has a very good direction to head into. Again, we will make her email available, and I suggest that people start their own groups so that you guys, can talk amongst yourselves on how you want to go forth, and then them building a national legal team that can support the decisions of the majority rather than the few. So with that, this case file, Dr. Pam Popper, was TLI approved. Very good interview. Hopefully we'll have her on again soon. And with that, I am keeping you awake, Jake, and the Lost Info podcast, and we are out. Peace.